All right, in chapter 24, lesson 2, we're going to talk about preventing and treating STDs. The first thing that should come to mind, especially after chapter 8, lesson 3, is abstinence. If we can avoid sexual contact until we're ready or until we trust our partner, then there's a much lower likelihood of contracting anything that would resemble an STD or an STI. We know that's not always possible, nor do you always know the history of your partner, or your partner may be asymptomatic, but we can at least make some small changes in our lifestyle to make sure that we don't get these things. Prevention starts with abstinence. The most successful method to prevent the spread of STDs is abstinence. If we can take the irresponsible people who are making poor choices, having multiple sexual partners out of the equation, we're going to prevent these things from getting around. 9 million American teens contract STDs annually. That's a big number. Any STDs that are not diagnosed early and treated can result in serious permanent or long-term health consequences, as we discussed in the last lesson, especially infertility and cervical cancer, things like that. The only method that is 100% successful in preventing the contraction of STDs is abstinence. Sex can wait. There's no doubt about that. Avoiding high-risk behaviors can also kind of cut down on the spread of STDs. We're talking about things like alcohol, drug use, whatever. High-risk behaviors include being sexually active with more than one person, having multiple partners, engaging in unprotected sex. Condoms and other protection methods may not be 100%, but may cut down on the risk and may prevent the exchange of bodily fluids. Engaging in sexual activity with high-risk partners. Maybe there's somebody has been with other people, has had multiple boyfriends, girlfriends, that type of thing. And certainly using alcohol and other drugs. Alcohol is a big one because we know it's legal, especially at the age of 21. A lot of people use it. And, when people are drinking, they make poor decisions. The same reason why people drink and drive, when everybody who's ever gotten a driver's license before knows they shouldn't drive a car when they're, drinking alcohol. But they're drunk, they're not making good choices, and people will hook up and have sexual contact with people when might not have been the thing they would have chosen to do had they been sober or clear of mind. The HPV vaccine is a big one out there now that teenagers are getting that can help reduce or prevent some of these STDs, especially HPV. It's a vaccine that can prevent cervical cancer, precancerous genital lesions or sores, and genital warts caused by the genital HPV infection. Protects against 4 types of HPV infections. The 4 most common, or at least the ones that they have some control over, including specifically relating to health officials. And they recommend that the vaccine is for males and females 9 to 26 years old. So my guess is most of you listening to this PowerPoint have probably had it. Gardasil is the most common one. I wouldn't be surprised if there's other ones out there. When talking about diagnosing and treating STDs, only a healthcare professional can accurately diagnose and treat an STD. That may sound like common sense, but a lot of people use the internet or friends or family to have these discussions and say, yes, you have this, or it sounds like you have a cold or a flu, whatever. And being that STDs and STIs can be something that's embarrassing, very private, again, people will turn to the internet, and it's not always going to be reliable information. So please, 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 use a physician or a doctor to get an accurate diagnosis. Teens who believe they might be infected with an STD should talk to a healthcare professional. Many public health clinics provide information and treatment free of charge. And not all genital infections are STDs. Some are localized skin infections and rashes. Quick funny story, I had a buddy from high school, actually from growing up, who in college, he's a very religious guy. So he was he had not had sex. He was a virgin. And he was having some burning during urination. And so, went on for a couple days, probably even a couple weeks, to the point where he decided to go to the doctor. He was hoping it would clear up, but he went to the doctor. The doctor kind of checked him out and started asking him some questions and said, hey, how many sexual partners have you had? And he said, none. And the doctor's like, no, you can be honest with me. Tell me, who have you been having sex with? And he said, no, nobody. The doctor actually started getting mad at him and saying, hey, I'm a doctor. You can be honest with me. And my buddy was like, look, I got nothing to hide. I got nothing to tell you. I haven't had sex with anybody. And it turns out it was just a bladder infection. But of course, the doctor thought it was going to, thought it was an STD at early, early glance, kind of early diagnosis, and that's what he suspected it was, and it turned out it wasn't. When it comes to our bodies, we really need to act responsibly. Everyone has an obligation to prevent the spread of STDs, making sure that we're getting ourselves checked, we're making sure that we know who we're having sexual contact with, and making sure we're not spreading it to others should we come in contact with someone who is infected. Again, because it's asymptomatic, because it can happen very, very quickly, it can be difficult, but that's where you have the obligation to get tested. One way to help control this epidemic is to practice abstinence. Wait to have sex till you truly know it's with somebody that you're ready to do that with. Don't just do it irresponsibly and whenever it feels right. Second way is to report any known infections. Should something happen to your body or you start getting some symptoms, go to the doctor and get them checked out. Get them reported. It's not like your name's going to be put in the newspaper, but at least that information can be used to help create medicine, diagnosis, and things like that that may prevent someone else in the future from getting it. It is responsibility of any person infected with an STD to notify everyone whom he or she has had sexual contact with that they could be at risk for having it. For some people, that's harder than others to admit you have something like that. But again, it could save a life. It's really, really important that you do that.